Hello, everyone, and welcome back to the AthenianEmpowHer podcast, where we highlight women leaders and their journeys in the professional world pursuing their passion. I'm Siri, and today we have a wonderful guest, Dr. Jasmine Faldu. Dr. Jasmine is an orthodontist based in the Bay Area. We'll be learning more about her work in orthodontics as well as advice she has for young women looking to pursue this career and its specific pathways. So, whether you're a future orthodontist, an aspiring design major, or just someone who loves a good story about a successful and inspiring woman, this episode is for you. Jasmine, welcome to the podcast. I'm so glad to have you here for the fourth episode of season 2.
Hi, Siri. Thanks so much for having me today. I'm super excited to chat with you, kind of talk a little bit about my journey, and hopefully inspire some listeners.
Okay, just to start off, Dr. Jasmine, tell us about yourself, where you went to college, and what your major was.
Yeah, we're filming, I guess, on the West Coast, but I'm actually originally from New Jersey. And so grew up on the East Coast, born and raised, a small beach town in Jersey. And that kind of found myself in high school interested in orthodontics. Didn't really know what I wanted to pursue for sure, but was really strong in math and science. And so after high school, I went to NJIT, which is the New Jersey Institute of Technology. It's a small engineering architectural school. And then I majored in biomedical engineering with a concentration in biomaterials and tissue engineering. And so I had a really challenging, rigorous undergrad, but I wouldn't change it for the world. I think setting up the way I think to think like an engineer, the why and the how, truly, honestly, has made me a better doctor and a better orthodontist, and kind of thinking about how I do things in my day-to-day profession. And so oftentimes I'll get asked like, oh, why did you switch from biomedical engineering to then dental school? And it was actually never really a switch. It was always part of my overall game plan, was to major in engineering because I had a strong liking for math and science, and then to apply to dental school and eventually to orthodontics.
I see. So that's kind of how you decided to pursue being an orthodontist, or was there also some other overarching factor that you were considering?
So I was in braces like many people in high school, and my orthodontist was my mentor. And I thought it was fascinating what he was doing in the office and the practice. It started off with me just like volunteering in the summertime. And then that slowly became like working for him more often, doing sterilization in the back, learning kind of overall treatment planning of orthodontics at a very basic level. He was a great mentor, and I worked with him for a while. He had a great office in New Jersey, Dr. Stephen Azanza, and that really sparked my interest in orthodontics, and I kind of stuck with it all the way through. That was really what I thought was interesting, because I would go in for my own appointments, and I was so fascinated by everything that was going on. I was like, it's a kind of a art, but it's also a science. You're using your hands. And so it was, yeah, that's kind of really what pushed me to go in that direction and kind of look into it. And then choosing a college major, I knew I didn't want to just major in biology. There was a lot of pre-med, pre-dental students majoring in just biology, and I kind of wanted to set myself apart a little bit. Had a couple cousins that were biomedical engineers, and I thought that was really a cool profession. If I had ended up not getting into dental school, for example, it was a great option or career to pursue. And so that kind of also is what played a role in that.
I see. Speaking of dental school, pre-med track, going to college, what is the specific career path to become an orthodontist? I understand there's college and then there's grad school, but then I the intersections where it gets confusing.
Yeah, definitely. So the path to getting, I'm going to give you like the basic timeline, right? So you go to high school and then you do a 4-year college degree because you need to get your prerequisites for dental school. And
Oh,
so oftentimes that includes getting a bachelor's degree and all of your pre-med slash pre-dental classes, which are the math, the science, even there's, English classes and things like that. You have to make sure you get all of these, what we call prerequisites. And so you can major in anything. You can major in history. You can major in econ, you could be a business major, long as you get the prerequisites you need for when you're applying to dental school. Then you go to dental school. Most dental schools that I know of in the country are 4 years. And so you go to a 4-year dental school program. And just like when you were in high school, you applied to college. When you're at college, you applied to dental school. After dental school, you apply to residency. And so there is a match program, very similar to the medical side, where you will send your applications out. You'll apply to all these different orthodontic programs across the country. Then they will send out maybe some supplemental essays and things you have to fill out, very similar to applying to college. Then you'll get invited for an interview. After an interview process, then you rank the schools that you were interested in, and those schools will rank all the interview candidates that they had. And then the match system pairs you together. So if you ranked a school number one, for example, like I ranked UCSF number one on my list, and then I was very grateful that I was able to match there, which means UCSF ranked me somewhere on that list that I was able to get into that program, because each program only has a set number of seats. So the short answer of that is 4 years of college, 4 years of dental school, and then usually 2 to 3 years of residency. The programs in the United States range from 2 to 3 years.
I see. So that's how you ended up in UCSF?
Mm-hmm.
I see. I've talked to and interviewed a doctor that has gone through residency, but how is residency in orthodontics different? Like how does this work? Is it just like working in like
That's
a
a great question because
facility?
it's very different. And so, well, a little bit of that timeline. I talked a little bit about NJIT and UCSF, but there was a step in the middle, which was my dental school. I went to dental school at the University of Pennsylvania. And so I was living in Philly for 4 years, and that was an awesome experience. It was great, great school, made some really awesome lifelong friends. But to go back to your question, um, residency in dental is very different than medical because you're usually not a paid resident depending on the program. There are a select few paid programs in the country, but you're typically paying tuition and you're getting a master's degree while you're in your residency program. And so the interesting thing about that is you kind of have to think about the long-term timeline of possibly your student loans, what your income is going to look like. So there's a lot of people that might decide that they want to go to dental school. They graduate dental school, they work for a couple of years as a general dentist, make some income, pay off maybe some of those loans, and then you can apply to residency and match for an ortho program. I went all the way straight through, but there's definitely a lot of different ways to do it because residency programs on the dental side typically are unpaid. And so there's 8 to 9 specialties in dentistry, and most of them are not paid programs unless you're like oral maxillofacial surgery, pediatrics. There's a handful of orthodontic programs that are paid across the country. Now UCSF is a paid program, but when I was a resident, it was not. So it kind of varies. And so that's why it's really important to do your research and really important to figure out what your priorities are when you're applying to programs. And that's the same for college, same for dental school, residency. You're looking at location, size of the campus. If you go on a campus tour, right, the culture, the vibe that you get, would you be a good fit there? What the tuition is, all those kind of different factors can play a role.
I see. So in residency, that's probably where you learned like all your main orthodontic skills, like all
So
the
you learn a little
procedures.
bit in dental school. And so dental school does a pretty good job at trying to expose you to all of the specialties if you do end up specializing, but you get very little experience in each one, right? And so you as a dental student then are kind of seeking out more opportunities, whether that means you want to shadow in the clinic if your dental school has residency programs that they offer. So at UPenn, we do have an orthodontic program. So either rotating through that clinic, trying to shadow in that clinic, shadowing private practice practitioners. So reaching out and saying, I'm interested in orthodontics. I think, that's something I might want to pursue. Is that, can I come in and kind of shadow you for a day? And so you do a lot of our hands-on learning, like truly what orthodontics is, what it means to be a clinician in orthodontics, definitely in residency, but you get to dip your toes in it a little bit in dental school.
I see. So shifting gears away from college and residency, I have a question. So everyone knows that orthodontists do braces and Invisalign, but are there any other procedures that you perform at in the clinic?
Yeah, that's a great question. And so the way I think orthodontists usually think about it is the braces, Invisalign, Spark, clear aligner, there's a lot of different type of products out there, right? They're all tools for us to get to that end goal. And so I guess another way to kind of rephrase your question is, do we just straighten teeth? And the answer to that is no, right? And so we're not only just straightening teeth. Yes, our one of our goals is for you to have a beautiful aesthetic smile, but we're also working towards function of your bite, right? And so making sure that your teeth fit together well. Cleansability, when your teeth are straight, it's easier to keep them clean. It's easier to floss, which means the health of the tissue around the teeth can have a better opportunity to stay clean. Your teeth, when they're in a clean environment, a cleaner mouth, right? We can try to keep our natural teeth for longer. And so the long-term benefits of orthodontic treatment far outweighs just like, I want straight teeth, right? So as an orthodontist, I'm looking at a lot of different things. I'm looking at not only the bite, but I'm also looking at the facial profile. I'm looking at how do these teeth fit within the skeleton of this person, and how will my treatment plan affect potentially their facial profile, their bite, their smile. There's a lot of new research coming out related to airway in orthodontics, right? And what role can orthodontists play in a patient's airway that might be struggling with sleep apnea? And so, is the upper jaw at the right width in relation to the lower jaw? And so, there's a lot more in orthodontics than just straightening teeth. So, that's, yeah, a great question. But a way to think about it is kind of what else are we looking at? And braces, Invisalign, those are all modalities for us to get to our end goal.
I see. Yeah, when I always think of orthodontist, I always think of what you said, like straightening teeth and like making your smile look good, but I didn't realize it was more complex and there's more like complications that allowed for it.
Right. And I think it's like when you're in a medical profession or really any industry, any profession, and you're interacting with people, you realize like you learn these things in a textbook, but in day-to-day life, you're going to see so many different variations of things, right? And so whether you're in medicine, whether you're a lawyer, whether you're an orthodontist like myself, like every scenario is going to be a little bit different, right? And so yeah, we're looking at kind of the bigger, greater picture, and it's a lot of fun. Yeah, it keeps the day-to-day pretty fun and challenging, and yeah, I enjoy it.
Yeah, speaking of day to day, what does your typical day look like in the clinic from like start to finish?
Yeah, so it's a pretty busy day. Orthodontists are usually go, 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 because we do see quite a few patients. And so we start our day with a team huddle in the morning. We review the schedule. We talk about which patients are getting their braces on, which patients are starting Invisalign, which patients are getting their braces off, or maybe finishing their Invisalign journey, transitioning to retainers. And so we do a team huddle in the morning to kind of, get a feel of what the schedule is going to look like. And then we get rolling right into the day. We got music on, we're having a good time, we're putting braces on, we're taking them off, we're in the middle of treatment, maybe we're adjusting wires. And so we are seeing patients for a couple of hours in the morning before lunch. And in between patients, I'm usually working up cases, reviewing x-rays, calling general dentists that I'm working with on a case, calling families if I have an update for them. And so there's definitely some admin paperwork. I'm working on ClinChecks, which is how we submit for Invisalign or any clear aligners. There's these platforms that we work on the web that allow me to virtually see what the teeth are going to look like. And so I do a bunch of setups, which you can kind of think of it as like a smile design setup. And so if a patient is going through treatment in our office, either with clear aligners or if they're in braces, we use a product called Sure Smile. And so they're robotically bent wires, which gives me extreme precision with where the teeth are going to go. And so those are just parts of my day. And then usually lunch, whether I'll either be still catching up on some cases and enjoying my lunch at the same time. Sometimes we have companies come in to chit chat with us about new products on the market, or I'm kind of running around and maybe trying to meet some new dentists in town. And so, yeah, it's a busy day. And then the same thing in the afternoon. And we're doing growth and development checks, kiddos that are maybe not ready yet for ortho treatment, but we're monitoring how their dental development is and how they're growing and how things are changing. Those are sprinkled in there as well. And then, yeah, then we finish up at the end of the day and head home.
Yep. I don't know if we formally answered this yet, but do you work pediatric orthodontist or do you work with adults as well?
Yeah, so ortho actually changed a bit in my opinion after COVID, like after 2020, we've seen an increase in adult patients. And so I work with teens, kids, and adults almost like 50-50, which is great. It's a nice balance. Orthodontics previously, I think you should be primarily kids,
Mhm.
but now we're seeing a lot more adults, and the treatment modality, like with Invisalign, like you brought up earlier, any clear aligner, has allowed us to straighten teeth, correct bites, make huge changes for these patients who are like, I don't want braces. I'm in my 40s or 50s, right? And so they're like, is there anything I can do? And yes, the technology has improved significantly that we're seeing a lot more adults commit to orthodontic treatment. And it's awesome to see that because it's not just about straight teeth, right? It's about function, keeping things clean, and investing in your smile so it can last long term.
Exactly. When you're meeting new patients that are all ages, what is one of your favorite parts when working with new people?
Working with new patients is fun because I don't think they realize how fun this journey is going to be. And our office is awesome. And so we have a really cool reward system in our office that just kind of encourages patients to clean their teeth, right? To brush well, to not break their appliances, to wear things properly, to show up on time. If they get good grades, if they're a kiddo, if mom brings in or a parent brings in a report card, you get points for that. And so I think the most exciting thing about new patients is a lot of people have dental phobia and a lot of people don't have positive dental experiences maybe in their childhood and then that kind of carries with them right for years to follow. And so our goal, especially in our office, we keep it fun, we keep it light, it's a good time. And I think that surprises patients, especially the new ones. And I think that's probably one of my favorite parts is like you can really see some kind of relax in the dental chair when they realize that we're going to explain everything we do before we do it. What we do here is not scary. What we do here is going to be a lot of fun. You'll get rewarded with awesome points. You get prizes and gift cards along the way. And so, yeah. And then from a more clinical standpoint, I would say it's the confidence of patients. Some patients start treatment and it's hard to get them to smile. They don't even want to smile. And I'm in the smiling business, right? I want people
Your
to smile.
job, yeah.
I want people to show their teeth off. And so it's really amazing to see that journey from super shy, didn't want to smile, to the day they get their braces off, they're like beaming. And even like halfway through treatment, just more confident in their smile. Yeah. And so those are a couple things that are really fun about it.
What is one piece of advice you could give to someone who is interested in pursuing a dental career, whether it's like orthodontics or just like basic dentistry?
Yeah, so I would say it's a long journey. And sometimes you wonder, like, how am I going to get there? And I think if you're really, passionate, you're really determined to do it, you'll be able to do it. And it sounds so cliche, but it's literally like, don't give up, right? Because it's going to be really hard. Every step of the way is going to be really hard. And I'm sure that you feel like if you're in high school now, high school's really hard, right? You're taking AP classes, you're an athlete, you are juggling so much, right? But you're going to get through it, you're going to graduate, you're going to get your high school diploma. You move on to college. The amount of volume of information that you need to memorize is like 10x, right? And you still need to be active in clubs, and maybe you have some sports you still want to play, right? Or you might be a college athlete. But you get it done, right? And then you move on to the next thing. And so there's so many times along the journey where you may feel like you want to give up, and it is you're looking at the long term, right? I am so grateful now that I'm an orthodontist. I love what I do. I love my team. I love working with our patients. And what I do is so unique that my husband actually asked a group of us a couple weeks ago. One is a pediatric dentist, one is a general dentist. I'm an orthodontist. And he was like, all right, question, like if you could do anything else in the world, like what would you do? The three of us thought about it for a long time and I was like, I love what I do. I can't imagine wanting to do anything else. And he was like, wow, really? He's like, you look in people's mouths all day. And I was like, yeah, but you see beyond that. It's just, you don't even think about it. And so I would say if you really want to pursue this career, go for it. If doors close along your way, let's say you don't get into dental school the first round, you can always reapply. If you don't score well in the DAT, you can always take it again. Like there's just so many opportunities along the way to get to that end goal. I have many colleagues that all have a different story, whether that's taking the DAT more than once, applying to dental school more than once. Maybe you get into dental school, but you have to apply to residency again, or you don't get into your top choice residency program, but you make the best of it. I mean, there's so many ways to do this path or this journey, right? That would be my biggest piece of advice is like, don't give up. It's a long haul, but it'll be worth it.
Yes. Well, I want to thank you so much for sharing your experiences with the podcast today. Being an orthodontist seems very interesting, yet challenging, and has all of its different intricacies that maybe the public won't know and our audience won't know. And I'm sure that many young individuals listening will be inspired to learn more about all the cool things that y'all can do. For everyone listening, I hope you enjoyed our fourth episode of season 2. Don't forget to follow us on Instagram, check out our website, and watch our interview on YouTube. We've got more amazing stories and guests coming your way, so stay tuned.